Hello, my name's Kyle, and today I'm going to be instructing my friend Tina here in a couple of vestibular exercises to see how well her vestibular system is working and if it's communicating properly with her eyes. Okay, so first we need to start with asking Tina, do you have any issues with numbness, nystagma, or nausea, anything of that nature? And then we
No.
can move on for not only the three N's, the five D's, and the two A's, which would be dizziness, double vision, trouble speaking, trouble swallowing, drop attacks, any ataxia or anxiety that has been recent.
No.
No, wonderful. Any rheumatoid arthritis or fusions to the cervical vertebrae, which may even impact our ability to perform certain tests today.
No.
Wonderful. And no history of vertebral artery insufficiency. Okay, or vertebral basal artery insufficiency. Okay, so let's get started. So what we're going to start with is an ocular alignment test. So for this, I'm just going to instruct the patient to look straight ahead, and I'm going to be comparing side to side. So just kind of looking at the eyes here, looking for either deviations upward, downward, or side to side. Tina does not present with any EXO or EXO deviations or hyper or hypo. So that's good. We will be doing a further analysis of that in a minute with doing the eye cover test. So what we want to look at next is just general ocular movement and mobility. So Tina, I'm going to have you look at the tip of my pen, and I'm going to trace an H. So we're going to come over, we're going to come up, down, back over, good, down, and up. Very good. The patient did a great job keeping their head stable, and their eyes were able to track each direction. What we'll do next is a convergence test. So this will be specifically looking at cranial nerve number 4, the trochlear nerve. So instructing the patient to look at the tip of the pen there, and then instruct them to inform you when they see 2 of the pens.
No.
All right, very good. And there was inferior and medial deviation of the eyes, which indicates that the trochlear nerve is intact. Also, ocular mobility was tracking or testing for cranial nerve number 3. With the H movement, looking side to side, which we will pursue a little bit further with smooth pursuits and saccadic. Now we can look at the abducens nerve, so cranial nerve number 6. All right, so what we're going to do, I'll have Tina, if you could look at the tip of my pen, and I'm going to go side to side here. Keep your head still. Now we are looking for overall general mobility of the eyes, able to track perhaps further in one direction. For Tina, she's able to go to end range in both directions, and there is no nystagmus. If we started to see a nystagmus, which is a fast beating impulse, we would want to assess which direction it is occurring at, and making sure that specifically it's not upward or downward beating, which could be indicative of central nerve lesion or central vestibular crisis for that matter. So what we're going to do next, Tina, if you could do me a favor, I want you to look at one of my thumbs here. And when I say switch, I want you to switch your eyes to the other one while keeping the head neutral. So let's go ahead and switch. Good. Switch, 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 and switch. Very good. No left or right beating the nystagmus, and no upward or downward, so we are doing well. Next, we're going to do smooth pursuits and saccadic eye movements up and down. So back to the pen, tracing it down, tracing it up. Very good. Able to keep the eyes fixated on the target, but the head stays neutral, no compensation. So let's do saccadic eye movement. So let's go ahead and look at the, we'll start with the top thumb there, and switch for it. Switch, switch, switch. Very good. All right, so that takes care of the ocular alignment, mobility, convergence, smooth pursuits, and saccadic eye movements. A nice little mnemonic I like to use is see whose saccadic skew is very smooth, which kind of hits all of our topics here. But we have 2 more things we're going to do, or 3 more, sorry. We got to do VOR, test of skew, and we're going to wrap it up with a head impulse test, which I like to save for the last. So let's do the test of skew. Tina, could you just cover up one eye for me? Now, although I'm going to be looking at, she's covered up her left eye, so I'm going to be assessing her right eye. Looks great. There's no deviation. When doing the test askew, you are actually assessing the eye that you are uncovering and making sure that there wasn't any deviation away from neutral. So let's go ahead and remove the hand. Very good. And the eye was in perfect alignment. Let's go ahead and do the other one. Letting them sit there for a little bit and then removing the hand. Very good. And ocular alignment is perfect. Next for VOR, the VOR stands for the vestibular ocular reflex. This is the body's ability to maintain an image or a capture on the fovea to interpret that picture. And when turning your head quickly, you can still keep your gaze at the target that you were looking at. So, Christina, for this next one, what I'm going to have you do is look at my thumb for me, and I'm going to have you turn your head one direction while keeping fixated on that thumb. Very good. And then let's go the other direction. You can start out slow, making sure that they can achieve very good end range in each direction. And then we can repeat that at a little bit faster. So we'll go ahead and switch, switch, switch. And you kind of want to just bring it up in intensity, making sure that they're able to fixate on that target. Next is the head impulse. This is a really hard one to do. So what we will have is Tina will take a seat here, and we will slightly adjust the cameras. And apologies if you can't see this on that one, but I want you to look straight ahead for me at my nose. And I'm going to, is it okay if I turn your head this way? Good. Look towards me. Wonderful. And just maintain. Good. Get them to relax a little bit, because when the rapid impulse comes, it can be a little, a little surprising. Okay. And again, you would make sure that there was no vertebral artery insufficiency, basal artery insufficiency, or any issues with the C-spine. So again, getting them to relax while looking at that nose, and then a quick, good, relax. Wonderful. And once more, I like to do 2 on each. All right. So there was actually a little bit with from right to left. So it'd be a left-sided head impulse test. There was a little bit brief deviation to the left, which would mean that the testing side is would be possible hypofunction. So we could have a further testing occurring from here. Do you ever get vestibular issues, blurred vision, or feel like the room's spinning? No? Mm-mm. Okay. All right. So it might be something where, in her particular case, because she's asymptomatic, we could perhaps just do some VOR training while looking side to side, staring at a thumb, or perhaps up and down. Or you could do a VOR cancellation. Times 1 would just be the head. Times 2 is moving the finger, or times 3 where you're actually doing both. That one's a little difficult. It's kind of like rubbing the belly and patting the head. But thank you for listening today, and thank you for your assistance. Appreciate it.